So hello all, we will discuss about invasion and metastasis. So what is invasion and metastasis? So these are the defining features of a malignancy. So a tumor which exhibits the property of metastasis is always a malignancy. So it is the primary defining property of a malignancy, that is metastasis. So what are metastases? Metastases are tumor deposits physically discontinuous with the primary tumor and located at distant tissue. So suppose here there is a tumor in my body, okay, and if this tumor through the blood vessels disseminate to a distant location and form a tumor at a site not connected with the primary site, a tumor deposits and then form a large tumor there, then that is called metastasis, and this process is called metastasis. So metastasis are the tumor deposits formed and the process is called metastasis. So what is the significance? So it is the first and most important criterion defining malignancy. So benign tumors never metastasis, only malignant tumors metastasis. Okay, so few exceptions are there. Not all malignant cells metastasis, only few exceptions. Those are gliomas. Gliomas are malignant tumors of glial cells in CNS. These do not metastasis. And basal cell carcinoma of skin. Okay, so which are the metastasis that does not which are the malignancies that does not metastasis? Those are gliomas, which is the malignant tumor of glial cells in CNS, and the basal cell carcinoma of the skin. So metastasis is the most common cause of cancer related death and reduces the chance of cure. So if someone is having a cancer, then the prognosis actually depends on the extent to which the metastasis has occurred. Metastasis, it is the most common cause of cancer related death, and if for a cancer that is highly invasive and has metastasis to much extent, the chance of cure is very low. So what are the factors favoring metastasis? So poorly differentiated tumors, rapidly growing tumors, and large tumors. Okay, these are the tumors which metastasize the more. So large tumors, rapidly growing tumors, and poorly differentiated tumors. So morphology, what about morphology? It grows multiple round nodules of varying sizes, cannonball appearance. So metastasis can look like multiple round nodules of varying size, and in microscopy they resembles the primary tumor. And but in some cases the metastases are highly anaplastic that we cannot identify which is the primary tumor. Anaplastic means lack of differentiation. The metastasis become so anaplastic that we cannot identify the primary from which primary tumor metastasis occurred. So in that cases we require immunohistochemistry or electron microscopy to identify. Next is the pathways of lymphatic spread. The most common pathway for carcinomas are lymphatic. So for carcinomas, most common is lymphatic, and for sarcomas, most common is hematologic spread, that is via blood. Lymphatic is via lymph. So most carcinomas is the malignancy of epithelium, and sarcoma is the malignancy of mesenchymal cells or mesodermal cells. And most common pathway for carcinomas are lymphatic spread, and the mechanism is that tumor cells invade the lymphatics. So this is a tumor cell and it invades the lymphatics. So this is the lymphatic vessels, invades the lymphatics and flows through the lymphatics and reaches the sentinel lymph node, that is the first node receiving the lymph drainage. So the tumor from the tumor, cancer cells invade into the lymphatics and form tumor emboli, and they travel through the lymphatics to reach lymph nodes. In the lymph nodes, we know that this is the capsule, and they have a subcapsular sinus, and the subcapsular sinus is the first to get invaded by these lymph nodes. Then whole of the lymph node get invaded. So first the subcapsular sinus get invaded, and few terms are there, that is skip metastasis and retrograde metastasis. So skip metastasis is the process by which some metastasis bypasses the nearby nodes. That is, for example, some tumors of abdominal cavity, like stomach, may first metastasis into the supraclavicular nodes or lymph nodes. Those are called Virchow's node. So this is the example for skip metastasis, and next is retrograde metastasis. That is, they spread against the lymph flow due to obstruction. Okay, so the example for the retrograde metastasis is that from prostate cancer, metastasis occurs to the supraclavicular node. In this case, the metastasis occurs against the lymphatic flow, and in skip metastasis, they bypasses the nearby nodes and spread to distant nodes. Okay. Next pathway is hematogenous, which is the most common pathway for sarcomas, and veins are invaded more easily than arteries, because arteries are thick walled, so it is difficult for invading arteries, so they have thick walls, and veins are invaded more easily. And common target organs are liver and lungs, because all of the blood from portal circulation reaches the liver, and from the vena cavas, all of the blood finally reaches the lungs. So common target organ for hematogenous spread is liver and lungs. And the renal cell carcinoma is an example for hematogenous spread. I told you that the most common hematogenous spread is most commonly for sarcomas, but carcinomas like renal cell carcinoma, hepatocellular carcinoma, and also choriocarcinoma, in this case it also spread by hematogenous route. So, and the renal cell carcinoma causes invasion to the renal vein, and then it reaches the IVC and then reaches the heart. And from hepatocellular carcinoma, the cancer cells invade the portal veins, and it then reaches the hepatic veins, and then finally reaches heart. So most common target organs are liver and lungs. And then third pathway is through body cavities. Okay, so body cavities include peritoneal cavity, pleural cavity, then CSF invasion can occur into CSF. That is called drop metastasis, which occurs in medulloblastoma and glioblastoma. And then lung tumors can invade into pleural cavity and can cause effusions. And the cancers directly spreading into peritoneal cavity include ovarian and GI tumors. Then can also spread through epithelial lined spaces, like endometrial carcinoma can reach the ovary, and kidney carcinoma, renal cell carcinoma can reach the urinary tract by epithelial lined spaces. Okay, and it can also occur through direct transplantation, that is iatrogenic, through surgeries or through transplantation. The carcinoma can mechanically spread. Okay. So what are the routes of metastasis? Those include lymphatic, most common for carcinomas, then hematogenous, most common for sarcomas, but also occurs in choriocarcinoma, then renal cell carcinoma and hepatocellular carcinoma. And common targets include for metastasis include lungs and liver. That is, metastasis occurs mostly to lungs and liver, and not that the lung carcinoma and liver carcinoma are mostly spreading to hematogenous. That is not what I meant. I meant the hematogenous spread finally leads to the lungs and liver. Then direct seeding of body cavity, that can be into peritoneum, example ovarian and GA tumors, then pleural cavity from lung tumors. They can invade into pleural cavity and can cause pleural effusion. Then epithelial lined spaces, spread occurs through epithelial lined spaces. Example is endometrial carcinoma reaching cervix, then renal cell carcinoma reach bladder, and then it can also spread via direct transplantation through surgeries. And next is invasion metastatic cascade. This is very important. And so invasion metastatic cascade actually it is a mechanism by which the cancer cell invade the extracellular matrix and through blood vessels reaches a distant site. That is, it is a process by which a tumor metastasizes, and steps for invasion metastatic cascades include: first is invasion of the extracellular matrix, and this is the first step, and then vascular dissemination, the spread of the tumor cells via blood, and homing of tumor cells. So first of all, invasion, extracellular matrix invasion. So first step is loss of E-cadherin. So what are E-cadherins? Cadherins or cadherins. C-adherins, C-adherins or E-cadherin. So what are they? So normal cells are attached to each other by E-cadherins. So this is a normal cell and they are attached together by E-cadherins. And tumor cells, in tumor cells, most of the tumor cells, there is loosening of E-cadherin or complete absence of E-cadherin that can lead to detachment of cells from each other. So the tumor cells become loose, they detach from each other due to loss of E-cadherin, and the tumor cells then secrete matrix metalloproteinase, meaning proteolytic enzymes. Tumor cells secrete proteolytic enzymes. For what? For degradation of the extracellular matrix. And the extracellular matrix includes what all? First of all, basement membrane of the tumor cells, then the interstitial connective tissue surrounding the tumor cells, and then the basement membrane of blood vessels. These are included in the extracellular matrix. So in order for invasion of the extracellular matrix, we have to degrade all these three in order, and for that the tumor cells secrete proteolytic enzymes which include matrix metalloproteinases, cathepsin, and urokinase plasminogen activator. Okay, these are the proteolytic enzymes secreted by tumor cells. So there is local extracellular matrix degradation by matrix metalloproteinases, cathepsin, and urokinase plasminogen activators. So these are the proteolytic enzymes secreted by the tumor cells. So these enzymes degrade the extracellular matrix. The extracellular matrix is degraded, and the tumor cells has some receptors that can bind to other cells of the ECM, the proteins of the degraded extracellular matrix, and this binding leads to the migration of tumor cells, migration or locomotion of the tumor cells across the direction of degradation. And The locomotion and migration are driven by autocrine motility factors. So initially the tumor cells are attached to each other by E-cadherin. So and loss of E-cadherin causes loosening of tumor cells, and after that they secrete the proteolytic enzymes that causes degradation of extracellular matrix. Then they binds to cells of extracellular matrix by certain receptors, and after binding they migrate or they undergo locomotion driven by the autocrine motility factors. And after migration, next step is vascular dissemination and homing. That include intravasation. First step is intravasation. That is the tumor cells penetrate the basement membrane. They penetrate the basement membrane and reaches inside the blood vessels. So the tumor cells they penetrate the basement membrane of the blood vessel and reaches inside the blood. So here there is blood there are tumor cells, and they get surrounded by platelets. In order to avoid attack by immune cells, and also to reduce the shear stress, they get surrounded by the platelets. Okay, so they get surrounded by platelets, and this is called a tumor emboli. And then they move through the circulation and arrest at distant location. That depends on the flow of blood and tropism. That is, certain tumor cells have tropism or specificity for certain tissues, and they arrest the flow of the tumor cells through blood, arrest at specific location distant to the primary tumor, depends on the tropism, and they extravasate depending on the organ tropism. And then these steps of invasion occurs in the reverse order, and they reaches the distant site, and there they form micrometastasis. That is, small tumor cells are formed at distant location, and these then develop into a macroscopic tumor, that is a large tumor. Then angiogenesis occurs, which is needed for the growth of tumor. Angiogenesis means formation of new blood vessels, which is essential for a tumor formation. The target sites and organ tropism. The certain organs like skeletal muscle and spleen are highly resistant for metastasis. That is, metastasis rarely occurs into these organs, and most metastasis occurs into liver, lungs. Liver because most the portal blood finally reaches liver, and lungs because vena cava blood finally reaches the lungs. And metastasis also occurs to bone, brain, and adrenals. So these are the most susceptible organs. Most resistant organs are skeletal muscle and spleen. Now these are examples for specific sites of metastasis. The metastasis to lung, in case of lung, the common primary tumor is breast carcinoma. For adrenal gland, primary tumor commonly is lung carcinoma. For liver, commonly lung carcinoma, then colon, then pancreas, then breast, and least commonly stomach. For brain, primary tumor is from lungs, then breast carcinomas. For bone, most commonly prostate, lungs, breast, thyroid, kidney. For skin, in males, most common primary tumor is lung carcinoma, and in females it is breast carcinoma. And for small bowel, primary tumor is melanoma, then breast carcinoma and lung carcinoma. For spleen, it is lung carcinoma, then breast carcinoma, followed by melanoma. So you have to remember this. There is no concept in this. You just have to remember this. This is based on organ tropism. And then bone metastasis. So vertebral column is the most common site for bone metastasis, and it is due mainly by paravertebral venous plexus or Batson Batsen's venous plexus. So through this venous plexus, metastasis occurs into vertebral column, and bone metastasis can be osteolytic and or osteoblastic. Osteolytic means in X-rays there is radiolucency, and in osteoblastic there is radio-dense appearance in X-ray, and in osteolytic metastasis it is due to bone destruction, and pathological fractures can be seen, and hypercalcemia is present. For example, lung carcinoma shows osteolytic metastasis, and while prostate carcinoma shows osteoblastic metastasis. Means there is reactive bone formation in metastasis, and there is increased serum ALP due to reactive bone formation. Now these are the take home points you must remember. So the most common spread for carcinoma is lymphatic. For most common for sarcoma it is hematogenous, and carcinoma spreading by blood include renal cell carcinoma, hepatocellular carcinoma, choriocarcinoma, and also follicular thyroid carcinoma. And which molecule, loss of which molecule is initiating for invasion, that is the E-cadherin, and the basement membrane degrading enzymes include matrix metalloproteinase, also cathepsin, and urokinase plasminogen activator. Then tumor emboli coat themselves with the platelets to avoid immune mediated attack of the tumor cells, and also to reduce the shear stress. Then cannonball lung lesion indicates the hematogenous metastasis. That is this is lung, and cannonball lesions on lung indicates hematogenous metastasis to the lungs, and drop metastasis is seen in CSF most commonly due to medulloblastoma. And prostate carcinoma bone metastasis is osteoblastic, while lung carcinoma bone metastasis is osteolytic. Okay, that's all. Thank you.